you may need.
No, that is fantastic. The next thing was, how can IMUNO be administered, and what is the benefit of the different routes?
Well, there are different routes. First of all, let's remember that we have to follow the rules. So, first of all, you have to find out in your country or in your state, if you are in the United States, for example, which are the rules for administration of supplements and what is legal, what is not. And of course, we encourage everybody to stay on the good side of the law. So whether you are a naturopath or a medical doctor, follow the rules. Don't administer things unless they are authorized in your state or your country. This having been said, and I think it's quite logical, we have to consider that IMUNO is manufactured as a sterile, natural nanoemulsion. And these three adjectives, sterile, natural, and nanoemulsion, provide a great deal of versatility as far as bioavailability and therefore ways of administration are concerned. Now, the most common way of administering a supplement is through the oral route, and it definitely works. But also, since we're talking about the mouth, we can talk about sublingual administration. Under our tongue, the mucosa is very thin, highly vascularized, and we know for decades that things that are put under our tongue are promptly absorbed, they go into the bloodstream and they exert the effects. And IMUNO, because it is a nano-emulsion, is perfectly fit for this way of administration. And another way of administration, if you want to target, for example, the immune system in our lungs, because maybe there is some pathology where you wanted to target the immune system in the lungs or in the bronchi, is a nebulization with a common nebulizer. Again, since it is a nano-emulsion, no problem in being nebulized. Or you may wish to use a nasal spray to target the brain through the olfactory nerve. Now, the olfactory nerve is the trade union between the nose and the brain, inside the brain, so you don't need to drill a hole in the skull to reach the brain. You simply have to use some deep nasal spray, and the olfactory nerve will serve like a door, so these molecules can climb, so to speak, into the brain. And again, since they are oily emulsions, it's a water oil emulsion from the physical chemical point of view, they can reach the brain through the olfactory nerve. And then, of course, there are the injections. Subcutaneous injections are the best way to deliver anything if you want to stimulate the immune system. As a matter of fact, when you want to vaccinate somebody, you use most of the times the subcutaneous or intradermal injection, because this is the best way to stimulate or rebalance the immune system. And when you have an adjuvant like IMUNO is, you have the maximum immunization response. Now, there is something interesting. Intradermal vaccines or subcutaneous vaccines offer the advantage they could also be self-administered, and there are proposals referring to vaccines against flu, for example, to send them through the mail so that people can inject themselves, by so doing, saving a lot of money, and according to the proponents of this idea, by improving the health of populations that are in areas of the world where you don't have too many doctors or are difficult to reach. So this feature of being a sterile nanoemulsion allows a great versatility. Now, there is also another way that is gaining momentum in these days, that is the transdermal delivery. Transdermal delivery means through the skin, possibly when it is combined with a cream or a lotion. We worked on transdermal delivery systems for glycosaminoglycans like chondroitin sulfate. Actually, we were working on heparin, that is a molecule closely related to chondroitin sulfate, since 2006, so now it's 13 years. And we were delivering heparin through the skin. and observing the biological effects of heparin once it was delivered to the skin. I think you know that when heparin is given as an antithrombotic drug, you have to inject usually in the belly, and you end up with bruises, not so nice. And then, of course, injections, they have a number of side effects. So because of this, we wanted to find a way to deliver heparin through the skin without resorting to injections. And we succeeded. We published this paper in 2006. And of course, now we use that expertise to deliver IMUNO, which is made of chondroitin sulfate that chemically is extremely similar to heparin. And since, again, it is a nanoemulsion, it's very easy for the IMUNO to cross the skin barrier. And beyond the skin barrier, or beneath the skin barrier, recently it has been described that there is a new organ. It is called interstitium. It is a complex network of microscopic tubules that connects all organs and systems. And most important, it connects the immune system to all organs. So I anticipate that since IMUNO is very young, that this will be a main way of administration. And the transdermal delivery of IMUNO will constitute a major breakthrough in delivery systems, and it will have a number of potential applications, even more than what we are thinking today.
Fantastic. That's very interesting. And I guess the next question would be, what conditions are IMUNO likely to be a benefit for?
Well, first of all, again, let's remember that IMUNO is a supplement, and let's remember that as medical doctors, we are bound to follow the standard of care that, of course, is different in every different country or state, and I strongly recommend all therapists and doctors to follow the standard of care for any individual disease. But this having been said, in the context of complementary, not alternative, natural immunotherapy, like, for example, nutritional interventions, IMUNO may have a number of indications. Essentially, all the conditions where chronic inflammation is present, where imbalances of the immune system and neuroprotection is needed. And this covers essentially most chronic conditions, including, of course, cancer. For example, autism, neurodevelopmental disease. There is neuroinflammation in the brain, and this has been amply demonstrated. The glial cells are activated, a number of markers of neuroinflammation are present. And also there are imbalances of the immune system, and of course the neuroprotection is needed. So autism could be a prime example of a condition where IMUNO could prove useful. And as a matter of fact, just a few weeks ago, Antonucci, a renowned world expert in autism, together with us, published a paper describing clinical cases treated with IMUNO. And many more cases will be presented at a conference in Romania in the next few days, and then at the World Conference on Autism in Chicago at the end of May, called Autism One. Let me quote just 3 of these cases very, very shortly. In one case, the behavioral symptoms are described by a score that is called ATEC, Autism Treatment Evaluation Checklist, after 2 months of treatment with IMUNO: bedwetting, wet pants diapers, soiled pants diapers, diarrhea, constipation, eats too much, too little, not sensitive to pain. Now, all these symptoms of autism, they improved from moderate to not a problem. So essentially, they were no longer there. And this indicated a complete normalization of these very significant symptoms of autism in this subject. Another subject: shows no affection, fails to greet parents, avoids contact with others, dislikes being held, cuddled. All these symptoms improved from very descriptive, so they were there, to not descriptive. So again, weren't there anymore. Complete normalization of these symptoms. Another subject: symptoms described that the queries: does not imitate, disagreeable, not compliant, indifferent to being liked. Now, the answers showed improvement from somewhat descriptive to not descriptive. Again, normalization of behaviors. And Antonucci, I know, he has many more cases. These are the cases that were published. So essentially, we are observing these effects of immuno in autism that are due to these to the complexities of mechanism of action that I quoted before. Probably most important are the effects on neuroprotection, anti-inflammatory effects on the brain, but also restoring the immune system at the level of the deep cervical lymph nodes, the lymph nodes we have here, where the flow of lymph coming from the brain passes through. So, and this goes back to the paper together with Brestrit about the pathogenesis of autism. And talking about other conditions that might benefit from this complementary approach complementary approach based on immuno, I can tell you that in Germany there is a major hospital that is recruiting patients to be treated with immuno in the context of a complementary immunotherapy. Now, the first reports, they have not completed the study, but the first reports are extremely encouraging, and I've been told that traditional oncologists are amazed at what they're observing. Essentially, we are talking about late-stage cancer patients where the traditional oncologists had lost all hopes, and against all anticipations, against all hopes, these patients are doing very, very, very well. And I don't anticipate the actual results because this will be the object of scientific papers, but let me tell you that the results that we're observing are very encouraging. But then, as I said before, it can be, immuno can be very interesting as an adjuvant in the context of therapeutic vaccines. Let me spend a word, because usually in the field of alternative or complementary medicine, everybody seems to be against vaccines. And vaccines are linked to all types of side effects. There are anti-vax movements and so on. I don't want to enter into this field at this moment, but I want to say that the vaccines I'm referring to right now are not the conventional vaccines like measles, rubella, and mumps, but I'm talking about therapeutic vaccines. So those vaccines that are being developed to cure chronic conditions like cancer, Alzheimer's disease, multiple sclerosis, or HIV infection. I think it was only yesterday that in the prestigious journal Nature Medicine, researchers working at New York's Mount Sinai Hospital published a paper entitled Systemic Clinical Tumor Regression with In Situ Vaccination. So essentially what they observed in cancer patients, late-stage cancer patients, they vaccinated these patients with some antigens that sort of educated the immune system to fight the cancer cells, and there was a tumor regression. So the tumor shrunk because of these vaccinations. So these are the vaccines I'm talking about. In these types of vaccines, immuno could provide a formidable boost to the immune system, so it would amplify, would enhance the effectiveness of these vaccines. And as a matter of fact, in 2017, I published a paper entitled A Novel Method to Enhance Immune Responses Induced by HIV DNA Vaccinations, where I described the mechanism of action of immuno as far as enhancing immune responses to all types of therapeutic vaccines. So this paper was born out of the observation that Russian researchers, very recently, not from the old times of the Soviet Union, very recently they published a paper describing a HIV vaccine, HIV DNA vaccine, that was effective in 100% of the participants, but the immune response was weak. So that's where the idea of using immuno came from. It is, okay, they found a good vaccine, but the immune response that they are able to induce is weak. So why don't we simply potentiate this immune response by using something like immuno? And so this is where the paper came from. So I think that there are many conditions that can benefit from the use of immuno. Not only those, let's say, traditional for immunotherapy, but also some innovative conditions where all these properties of immuno may prove truly useful.
Wonderful, wonderful. I mean, first off, that's really helps in clarifying a lot about what IMUNO is about. And next off is just congratulations on such an innovative immunotherapeutic tool. So thank you, Dr. Ruggiero, for meeting with us today and sharing this exciting information on IMUNO. We feel sure it will be of great benefit to many people in the coming years, and thank you a lot for meeting with us and having a chat.
Thank you for this great opportunity. Thank you so much.
Thank you.
Bye-bye then.